Good morning to all my YouTube viewers. So today's video is how to take an orthopedic history in a workplace injury. So today's case scenario would be assuming that a person was injured because of fall of a heavy object from a height. It has to Today I chose the scenario to be a workplace injury because certain questions in your part of HOPI and your social history varies depending upon the workplace history. So to begin with, as every history begins, you start with the patient identification. So name, age, sex, register number, address, and race. So after that, the chief complaint would be injury post fall of a heavy object from a crane or from a certain height. The something that is heavy fell over the patient. Uh, so this would be your chief complaint. So alleged injury at the workplace. So to begin your HOPI, you begin with questions like what was the patient doing at that time. So if he was an instructor, for example, he was a manager or a supervisor, he was in the field instructing his labor, or he was a laborer who was working. So ask as what was his position, like what was his job there in the workplace. Then second thing is, did the incident occur during the working hours, because this has a role to play with whether the patient will be covered with the insurance or not. So as we know, the companies that hire the workers have their insurance, so anything that happens only during the working hours will be covered by the insurance, so we need to ask about that. Then whether the patient was wearing protective personal protective equipments, like people working in construction areas would be wearing the helmet and the working boots, the special things that would actually have a very important effect on the impact of the injury. So for example, a person wearing his working boots and a helmet and something fall over him, there's certain amount of protection that is being conferred over the patient, so you have to ask whether he was protected or not. Then since this scenario is something falling from a height, you have to ask as from how much height approximately did the object fell. For example, when a crane was lifting something that is very heavy and it was transferring the items, and during this process the thing fell over him, then he will say roughly the height was about 10 meters or 15 meters. So you have to have a rough estimate, because more the height, even the object was of less weight, the impact of gravity will cause the object to cause greater damage to the patient. So after that, you have to ask for the weight of the object, whether it was something like, if it was something like a plastic pipe, it would be less injuring to the patient compared to a wooden log. So ask as how much was approximately the weight of the object that fell over him. Then you ask as during the fall, did he try to protect himself. For example, if he tried to run, or if he tried to resist or something, so the injury mechanism of injury would be different. Like for example, if he tried to resist the fall with his hands, the injury would be more over the hands than the part where the object fell or landed over. So ask, did he try to protect himself. So after that, you have to ask at which part of his body. It would be obvious, mostly orthopedic patients are very obvious. The moment you look at the patient, you already know the site of injury. However, you have to ask as where it exactly fell over, because there can be a torsional force or tension which would have causes injuries even further, further the point of contact. So you have to ask him where exactly it fell. And then you ask the patient's condition during the fall of the object over him. Some patients, because of the shock, they would pass out. They might have syncope or faint. So ask whether there was a loss of consciousness, or does he remember everything what happened during the time. So after that, if at all the patient lost consciousness, then how long did it take for him to revive back, whether he got revived back on his own, or did someone around him help him out. And then after that, you have to ask immediately after the log fell, where did he feel the pain. Did he feel pain more over the site of fall or elsewhere, etc. And then how he was taken to the hospital. So once he is taken to the emergency, you ask the patient as what was done. Likely we know that when there is an accident, first the primary survey is carried out, the ATLS protocol, and then the trauma series X-ray would be done, the C-spine is cleared, and and then apart from that, other further management would be planned for. So, and eventually the patient would be admitted into the orthopedic ward. Here, in case like this, HOPI and the social history carries the most weightage compared to the other things. In a case like this, past medical history, family history don't really play a major role in management. Apart from that, drug or allergic history would play a role only if it is having any significance with the managing of the patient. For example, if he is on a long-term corticosteroid therapy or something, maybe the management plan will change for that patient. So highlight those points. After that, in the social history, you need to ask whether the patient is smoking, because irrespective of any type of injury, like whether it's a fracture or whether it is a whichever type of fracture it is, the healing has something to do with smoking, as smoking will slow down the process of healing. So ask if the patient is smoking, and if at all he is smoking, you have to remember in your management, you have to advise the patient to stop smoking. And then the drinking history, whether he's alcohol consumer or not. And you have to ask if the patient is the only sole breadwinner in his family, because now that the patient has got injured and hospitalized, how about the financial condition of the family? If he's the only person earning in the family, now we have to think about, because management of the patient in orthopedics is not just focused on the wound itself. We need to think about the patient as a whole. So we have to, because later on we have to refer the patient for occupational therapy, physiotherapy, everything. So you have to ask the patient, as is he the only person earning in the family, and if yes or no, you have to know. And then after that, you have to know that how the patient's finances will be carried on after this, like if he's getting admitted and if he has to pay for his treatment, so how will he be managing that part? Because if it is a workplace injury that happened during the working hours, then the here they call it SOXO. It's basically the workers insurance, so that would cover for his injury and management of that particular patient. So apart from that, you have to ask where does he live. That's a general part of history. Which floor does he live? For example, if he has sustained a fracture in his leg, now his lifestyle will probably get affected after this. So which floor does he live? How far he is from a primary healthcare setting or a hospital? And how is his living conditions, clean environment, clean drinking water or not? So basically you should have an idea about the social status of the patient, so you need to ask these questions. So end of the day, when you summarize, it's basically about the mechanism of injury. Other parts don't play a role in the summary. So in summary, you just have to tell patient X, who is of this many years old, smoker with this many pack years. If he has underlying diabetes or something, you have to highlight, because that plays a role in the management. With underlying diabetes, presented to the orthopedic department with presented to the emergency department with the injury during the workplace injury during his working hours, where he sustained injuries over his right leg or knee or wherever after the fall of a log from certain height of this and this weight. So post injury, the patient lost consciousness. He was helped by the working colleagues to the emergency department, and in the emergency so and so things were done, and he has been admitted for what procedure. So because orthopedics is not unlike medicine, it's not much of investigations or brainstorming as what has happened. It's like very straightforward. So you know this has happened, this is the management. There's nothing much into it, unless in certain cases where there are exceptions. So you can even tell about what is your plan of management in your summary. Like he has been electively admitted for open reduction internal fixation or plate and screwing or whatever. So that is basically an overview for history of a workplace injury. Thank you.